Okay. Welcome. Can everyone hear me okay? Yes, yes. Thank you. So welcome to the Reaching Home presentation. My name is Teresa Williams, and I'm the coordinator of the 10-year plan to end homelessness. This event is being recorded via MCAT, so I'm generally used to standing and moving around, but today it's going to be very similar to City Council format in that we're going to be seated and doing the panel presentation in this format. So I'm going to give you kind of a heads up of what tonight is going to look like. It will begin with opening remarks from County Commissioner Cola Rowley and also Mayor John Ingen. Then I'm going to provide an overview of Missoula's coordinated entry system and also include highlights from this previous year. We're going to launch into the panel presentation moderated by Susan Hay-Patrick, CEO of United Way. Then I'm going to provide an overview of our next and final phase in the plan. And then we will have questions and answers, and we'll also let you know some upcoming events. So without further ado, I will open it up to Commissioner Rowley.
Thank you. According to a consolidation of reports by U.S. News, America is the 12th richest nation by per capita GDP, and yet nearly 80% of workers live paycheck to paycheck. That's obviously not just low-wage earners. It's difficult for average or even above-average earners to have the life that their parents and their grandparents did. 44% of American households could not cover a $400 emergency expenditure, and only 39% could cover $1,000. This means if an unexpected expense comes up, medical bills, your car breaks down, roof leaks, you can't pay your basic living expenses that month. And once you get behind, it is daunting to try to catch up. 29% of Americans have gone to extreme measures, taking out a bank loan, going over their credit limit, or clearing out their savings account to be able to take a vacation. 1 in 5 millennials expects to die without ever having paid off their current levels of debt. The numbers I've mentioned are largely attributed to the fact that the costs of housing, healthcare, education, and other major expenses have increased at rates much faster than wages, which have stagnated for decades. And we have lacked the social infrastructure to keep up with and make lasting changes to these trends. Accordingly, the nation's housing crisis has continued to get worse. And more we realize, as I recently read in a Guidepost magazine, that self-sufficiency is a myth perpetuated by pride and temporary success. Health and wealth can disappear instantly, as can life itself. End quote. Luckily, we live in a community where the residents and policymakers are mindful of and willing to do something about it together. Missoula's collaborative approach offers an increased likelihood of success over the prideful who tempt to do it alone. So Missoula has hope, thanks to everyone in this room here today. And I thank you all and look forward to hearing an update on this amazingly important work.
Thank you. Mayor Ingen? Thank you, Mayor Ingen. Okay, let me get my PowerPoint person to the, thank you. Montana, everyone. Thank you, Montana. Okay, so 10-year plan and phases. I've got to adjust here. Okay. Next slide. Okay. We're going to work this through. Thank you for your patience. So the 10-year plan and phases. So if originally looking at the plan, having 10 years, that seems like a big chunk of time. How do you break it up? So the working group that created the plan decided to do it in 3 phases. I came on phase 2, building a coordinated system to end homelessness. So when I came on in 2016, that is where a lot of the work really took ground. We built out the infrastructure for the coordinated entry system, and we'll talk a little bit about that here shortly. Making adjustments to ensure sustainability. This is phase 3. In talking with other technical assistance providers that have worked in the communities that have ended homelessness, this is where they say it's the hardest phase. We haven't ended homelessness here yet in Missoula, but in other communities that have, again, trying to sustain that momentum and that infrastructure has been really challenging. So this is one area that I'm really excited to look forward to and keep working and building out our coordinated entry system and collaborating and working together. Next slide. So to give you a little background about my position as the Reaching Home coordinator, I wear a lot of hats, as you can see in this visual. I facilitate and convene a lot of meetings, as these guys know. I pull them from boots on the ground work all the time, trying to get everyone on the same page. But we understand that it's really important to spend time, zooming in and working on the ground, but it's also really important to be doing system level changes as well. So these guys know, and also people in the audience know that there's this balance that we're always trying to find. So that way, we're not just narrowed in, we're also zooming out and seeing the big picture so we can impact system changes. So my role is to ensure that we're in alignment with federal and state plans. And you're going to hear about that tonight, especially around the posters around the room, that our goal is to end homelessness and make sure that it's rare, brief, and one time only. So that'll be our theme tonight, and you'll hear a lot about that and the work that we do. My job is also to implement, update, and monitor plan progress. This is something that will also come out a lot in this next phase, and really trying to be transparent and report to the public and everyone else of what we're seeing regarding homelessness, more than just that point-in-time snapshot that we do every year with our homeless point-in-time count. So that's definitely a goal that we're going to continue to work toward. Community outreach and education. So a forum like this, a lot of us also do in-services around town. We speak to classes at the university. So we're always doing outreach and education to dispel myths and stereotypes, misperceptions around homelessness. So that's a big part of my job. Another large part is what's called the At-Risk Housing Coalition. We're going to leave some material before you leave, so if you're not a member of the At-Risk Housing Coalition, you can take a peek and see if you want to become a member. But this is where a lot of the work gets done with Reaching Home. We have several subcommittees that meet, and this is, I would say, yeah, like I said, this is where the meat of Reaching Home is all the tasks and everything happens there. So for example, we have our annual point-in-time count happening this Thursday. That is a lot of planning, and a lot of members on this panel are included in those planning efforts. We have Project Community Connect, that's this Friday as well. We also have, well, I'll talk about this later. Sorry, I'm getting ahead of myself. And then also the coordinated entry system. My role is to really ensure that we're implementing it in accordance with what the federal guidelines are, and that we're following our policies and procedures, and we're also following the statewide efforts as well. Thank you. So ending homelessness. I know when I came into this role, it seemed very lofty and almost like, really, how are we going to how are we going to end homelessness? And so I really appreciated this definition, and I think for a lot of folks that were involved in implementing and shaping the coordinated entry system, we were all able to come together around this definition, and it made sense to us. So I'm going to tell you about that. So it's to ensure that all people have rapid access to safe, long-term housing that's sustainable for them, that we have a system that ensures homelessness is rare, brief, and one time only. With that, we're mindful that that doesn't mean that people will never experience a housing crisis again. There are a lot of factors within this group that are beyond our control as far as institutions and people falling through the cracks. For example, the youth foster care system. A lot of people are leaving the foster care system and don't have supports, and so they're falling into homelessness. Same with prisons. People are being released without housing, and so we're doing our best at the local level to change our system so we could rapidly respond. But it's going to take some time because we do need to work on ending chronic homelessness first, so that way we can rapidly respond to people to ensure that it's rare, brief, and one time only. So next slide. Okay, perfect. So the coordinate entry system. Prior to coordinate entry, it was very maze-like that you'll see up here on the left-hand side. How do I get in? Which case manager do I find that knows the system really well? First come, first serve. So really difficult, and it wasn't fair and equal access. Now with coordinate entry, we have clear, easily accessible access points that are coordinating assessments and provisions of referrals for homeless housing assistance. So to be clear, this is not for your mainstream housing resources like Section 8. These are federally funded programs that serve people that are experiencing homelessness. So that's what the coordinate entry system is doing. And so our access points are so we call these kind of our front door agencies. So they're advertised, if you will. So it's the Human Resource Council's 211, first call for help phone line, the YWCA, Salvation Army, and the Poverello Center. We like to think of this as no wrong door, in that it doesn't matter if you are a single person that's not a family going into the YWCA. They're going to help you get into coordinate entry if you're eligible for it. So really, again, no wrong door. We want to simplify it. We want to reduce the burden on people experiencing homelessness and try to streamline those resources. Okay, now we're going to talk about some of the highlights. So enhanced efficiency. We're really proud and excited that we are using technology. I know that sounds kind of weird. Montana usually is one of the last places to use technology. The same for us in the homeless and housing field. This year, so I mentioned earlier, we have our annual point in time survey on Thursday. This is a national effort that happens on the last 7 days in January across the country. It's necessary for us because it helps us remain eligible for $2.4 million in grants. So very important for us to do this. Everywhere across Montana, it's a paper survey. This year, we're going to be using technology called Outreach Grid. So that will also ensure that we get real-time data versus waiting about 6 months to get it back from the state. So we're really excited to see that. And then the Homeless Management Information System. This is a new tool that we're using. We launched it in November, and already it's proving to show that our system is a lot more efficient, and we'll talk a lot about that. You'll hear about that through the panel members. With the Homeless Management Information System, that also means that we're going to have improved data collection. When we decided to launch Coordinate Entry, a redesign effort in 2017, we decided that we're just going to do it knowing that the technology is not there yet, that the state was working on it, and that it was going to come, but we felt it was necessary to build the plane while we're flying it pretty low, so not so high. And I think, I think it was a good decision on our part because we learned a lot about the system and where we needed to improve. And now we're able to see the data that's starting to come out, and we really want to make data-driven decisions and also to help promote change. So we're excited that in the next year, we'll be able to show you some of that data that supplements the point-in-time count. Increased capacity. So we have a new housing navigator and she's on our panel tonight, so you'll hear from her. We also have a housing retention specialist. This year, we met as a team. There were about 40 of us that came together and discuss what's going well, what's not going well, what do we need to have in our system to make it even better. And out of that discussion came these two positions, and so lo and behold, we made it happen. So they'll talk more about those roles as we get into the panel presentation. Increased access to income. So most of you probably have heard about Project Community Connect. It was previously known as Project Homeless Connect. We changed the name so that way people knew that you don't have to just be experiencing homelessness to come to the event, that it could be anyone that's in need. So Project Community Connect happens every year. This year we piloted an event called Project Employment Connect. We had 76 participants attend, and it was really neat because they could receive haircuts, interview clothes. We had employers at the event. They were receiving resume assistance. They were able to practice interviews. So we were really excited to pilot that mini Connect, as we called it. And so we're excited to be able to do that again this year. And then we also have SOAR, which stands for SSI, SSDI. Maybe I need to go into those acronyms. Supplemental Security Income and Social Security Disability Income, Outreach, Access, and Recovery. So this is a process where we train up folks in our community. We actually have, this last year, out of 33 people that were trained across the state, 17 of those were trained in Missoula. So we're doing a really great job training people up. But this helps people get access to disabilities for which they're eligible for. So they do have to have a severe mental illness, a severe physical illness, and be experiencing homelessness. This helps people, I think, I didn't queue it up. I have an infographic, but I didn't queue it up on the computer, so I'm going to try and do this by memory. Typically, it takes about 120 days to get a decision. Statewide, it's 60 days because of the SOAR process. And I don't remember what the approval rate was. But anyways, it's a really great program to help streamline and help people get access to benefits. Okay. Increased permanent housing interventions. There are a lot of staff here from Missoula Housing Authority. We want to shout out that their Cornerstone project was fully funded this year, and that's going to bring online 20 units of permanent supportive housing. These are units, specifically permanent supportive housing are for folks that have experienced chronic homelessness and need some higher level intentional services to help keep them housed and supported. So we're really excited about that. Increased collaboration. I mentioned earlier about the At-Risk Housing Coalition. This last year, we added a youth homelessness group to really tackle youth homelessness. We're also doing a really great concerted effort to increase how we count the number of youth, especially unaccompanied youth. So there are folks in this audience here today too that are doing a great job, and we're excited to add that effort this year. And then also the Housing Partnership Committee. You're going to hear from folks today about all of the barriers to housing that our folks that we work with experience. For example, we're helping people get vouchers, perhaps through Missoula Housing Authority, their permanent supportive housing vouchers. But we have 17 people right now that have vouchers that are trying to find housing, and it's taking a long time. So we came together and figured out, what do we do? How do we address this? So we have a team of people interviewing landlords to see what's going to help and what can we do to help reduce and mitigate the risk of renting to this population. So a lot of people coming together to get it done, to get the work done. We also have case conferencing. So these are people that show up every single week. They're all people on this panel here today and in the audience. These are 15 agencies that come together, multiple staff from those agencies, and we meet once a week for non-veteran case conferencing, and then also 4 agencies that meet for veteran case conferencing. So this is critical work in trying to match people to resources and services. It also increases the communication as well. Our goal within Coordinate Entry is to make sure we match people with high vulnerability to the most intensive and expensive limited resource to utilize resources wisely and effectively. We also have a coordinated outreach team. I was very intentional when I planned this panel. I really wanted to demonstrate how we are increasing collaboration. So we do have the entire coordinated outreach team on this panel, as well as the 2 new positions that I mentioned earlier. So you're going to hear from them tonight. Increased communication. Like I said earlier, I convene a lot of meetings, and part of that is a monthly access point meeting. So that's getting all the access points together, and we're going over, what are we seeing? What can we do to improve? And so really ensuring that we are, we're one access point. So I like to say we're one agency with one case, so we want to make sure we're doing everything the same. So it doesn't matter which entry point you go into, you're getting treated the same way and using the same assessment process. And then we also have a monthly coordinated entry system implementation meeting. So again, we're all building it and we're implementing it together. So we're nimble, we're adapting, we're changing, and we're using best practices in education and technical assistance as well. Our continuum of care funded programs in the last year provided new and ongoing services in 2018 to Missoula Housing Authority's permanent supportive housing vouchers, 222. I really botched that when I said that, didn't I? I apologize. So the permanent supportive housing program at Missoula Housing Authority served 202 men and women experiencing homelessness. Mountain Home, Montana provided housing to 7 parenting and pregnant folks that are in the transition age youth range. And then the YWCA provided rapid rehousing rental assistance to 74 families. Those are a lot of people that now have a safe place to call home. The Missoula Coordinated Entry System provides direct referrals to these programs. Like I said earlier, Coordinated Entry is referring people to our limited housing resources for people experiencing homelessness, and that's their eligibility criteria. We are excited because with the HMIS system, the Homeless Management Information System, we're going to have more agencies putting in their outcomes so we can also see the other successes. And sometimes it's not successes based on the housing that we have within the system, but it's also based on people that were able to find housing outside of the system and collecting those data points as well. Okay, so now I'm going to kick it over to Susan, where she will moderate the panel discussion, and we'll hear about more highlights from the panel.
Thanks, Teresa. And thank you all for being here. I was privileged to co-chair with then City Councilman Jason Weiner the steering committee that created the 10-year plan in 2011. And many of you in this room provided testimony and were great resources for us in developing the plan that was passed unanimously in this room by the City Council and the Board of County Commissioners. Planning the work is one thing. Working the plan is where the rubber meets the road. And today we are really fortunate to have this panel of dedicated, compassionate, passionate people who change and save lives every day. So I have some questions for them about coordinated entry and the outreach team, about the 2 new positions, about family homelessness. Then Teresa will talk about next steps, and then you'll have the opportunity to ask questions. So, and panelists, remember to push the little red button. And because there's so many of you, and you all have so much to say, we have to ask you to keep it brief, keep your answers brief. And thank you for that. So, in a lot of our work, we tend to be siloed. Nobody likes to ever say they're in a silo, so I like to call them our cylinders of excellence. So prior, you stay in your cylinder and I'll stay in mine. So prior to the changes that were brought about by coordinated entry, you were all out there doing the best work you could. Usually within a silo, sometimes siloed within your own organization. So now you are one big happy family of the coordinated outreach team. So I think it's important for us all to understand why that's so important and how it contributes to the goal of making homelessness rare, brief, and one time only. So I'm going to start with Hannah to ask you, what can you share with us that might surprise people in this room about people who are unsheltered? Oh, no, wait. First, I'm going to ask you all to introduce yourselves. That's what my notes say. So if we could, yeah, right. Already falling down on the job. If you could each say your name, your job title, and where you work. And then Hannah.
My name is Lori Pope. I'm a peer support specialist and the project coordinator for Open Aid Alliance.
My name is Hannah Higgins. I work on the homeless outreach team for the Poverello Center.
My name is Christy Shanowski. I am on the homeless outreach team at the Poverello Center.
Kimberly Bell. I'm a service coordinator with Volunteers of America.
My name is Randy Crasdale. I'm a Missoula City Police Officer for the last 15 years.
April C., Director of Outreach of the Union Gospel Mission of Missoula.
And I'm Melissa Brooks. I'm the Offsite Services Coordinator at Open Aid Alliance.
Matt Hendry, the PATH Coordinator for Western Montana Mental Health.
Sue Ellerman, the Housing Retention Specialist at the Poverello.
And I'm Yvonne Cooper, the new Housing Navigator over at Partnership.
My name is Jake Lapke, Care Coordinator for the PATH program at Western Montana Mental Health.
I'm Melissa Richards with the YWCA. I'm the Housing Program Manager.
Thank you all. Let's have a round of applause for these people. Hannah Higgins. What might surprise us about the folks that you meet through your work with the HOT team?
Something that really stood out to me when I first started was the variance in ages. We work with folks who age out of foster care a lot, so starting adulthood at 18 or find themselves within homelessness, to people who are approaching 90 years old and still camping, people who, have been through many different systems and, for whatever reason have failed within those systems where we failed them. Especially with youths, we're seeing struggle with basic skills for getting into housing right away. And we are looking at early intervention within homelessness with youths to make it more brief and non-recurring. There's also a really beautiful sense of community within the community that we get to work with, the way that folks look out for each other. And you give a tent to somebody one day, and the next day another person you're working with is using it, and people really do look out for each other, and it's great to be able to work with them in that sense as well.
Thank you. And Christy, you were working in the shelter for quite some time before you started working for the HOT team, right? Can you tell us why people might avoid staying in shelter?
So there's a number of reasons. People may be struggling with alcoholism or drug addiction and are unable to stay in the shelter because of intoxication. Some people suffer from mental illness, anxiety. There's just so many people in the shelter that some people can't handle that. Also, people with children, families, can't stay in the shelter here. You have to be 18 years old in order to sleep in the shelter. I've seen like couples, significant others, because they need to sleep in different areas. They're not willing to stay in the shelter. Also, people with pets can't stay at our shelter unless they're a service animal, and people aren't willing, which I totally understand, not to give up they don't want to give up their pets. Yeah.
Thank you. So we've heard some of this, but Melissa Brooks, Could you talk to us about the challenges? What's so hard about housing the most vulnerable people experiencing homelessness?
Yeah, well, there's a lot. I think it's important to note, like, more on a systemic level, like, just the, like, stigma, whether that be criminalization of poverty, homelessness, substance use, stigma against mental health. I think that really shapes our policies and our programs that we have, and unfortunately really creates a lot of unnecessary barriers. And then, you know, on the more direct level, well, I'm a strong believer that housing is healthcare. So if somebody doesn't have housing, you know, and they have mental health, substance abuse, whatever medical condition, that's already going to be very much exacerbated. And then things that a lot of us take for granted, you know, having a phone, access to a shower, clean clothing, and transportation, really, you know, makes it difficult. And then, you know, we're expecting them to show up to these scheduled appointments, you know, fill out all this paperwork. And then just even, you know, once they get to that point, unfortunately, we know how competitive housing and the rental market is in Missoula. And so things like just even being homeless and a lack of rental history is really going to be a barrier to being accepted. So there's a lot.
Thank you. Thank you. So, Jake, in the PATH, for the PATH team, why might somebody say no to an offer of housing? And then what approach do you take if that happens?
Yeah, sure. So our program, PATH at Western Montana Mental Health, was implemented to strategically assist individuals who are suffering from a homeless situation and who are suffering from disabling mental health issues. So with that comes a unique variety of barriers, right? Oftentimes I find that lack of communication with not having a cell phone, maybe substance abuse or mental health problems, symptomologies often become the biggest and most reoccurring obstacle that we see with these individuals. And I think that I can think of a specific example where we're trying to implement a housing intervention with a particular individual, and that was turned down because of that mental health symptomology. And so because of those things, you know, even though that a person's mental health symptoms have prevented them from accepting a possible housing intervention, we still will continue to work with them through those issues to hopefully regain that stability, implement services, and hope that even though it didn't work at that point in time, that we can still try to work towards helping them through their own barriers that are creating obstacles for them. And that's why we think that coordinated entry system is so important, because it pools together community resources, allows service providers to share information that allows us to continue with the individual's goals when their own barriers get in the way.
Thanks. And then for your colleague, Matt, we've all heard a lot about the results of the budget cuts on the mental health system. So are you seeing more people with serious disabling mental illness living on the streets now?
Heck yes. But really, most agencies, including Western Montana Mental Health, they have drastically reduced or have gotten rid of their case manager positions, or they closed their programs altogether completely. And because of these cuts, people are losing critical services to be able to maintain their housing that maybe we help them find. And so because they don't really have the case management to be able to help them maintain and sustain their housing that we actually help them get into. And so the PATH program, we definitely see an increase in referrals for people, not only in case conferencing at our weekly meeting. We're getting people referred to us that way, but we're also seeing a lot of people starting to come into our office on a regular basis, like on a consistent basis, to people who have lost case management. They're constantly coming into our office seeking case management to be able to get into services for housing and stuff. And then I had one such individual, one specific individual that was on my caseload. They had housing and case management services, but then they became homeless, and they lived in their car for about 2 years because they lost their housing. They lost their case manager, and then because they didn't have their case manager help them sustain their housing, they just lost their housing. And so that just tells me that they need a case manager to really help them sustain their housing. And so when they were referred to me, I had to, when they referred to me, I had to get them back into court and entry to be able to get them, to advocate for them, try to get their housing back.
Thank you. Lori, you were open about your own lived experience with homelessness, and how does that help you be an effective advocate for somebody who is struggling with homelessness?
So I get to, I get to connect with people on a different level. When I go out, I'm meeting people. First of all, when people are experiencing homeless, it's very scary. It's traumatic, and we don't trust a whole lot of people out there, and we've been abandoned, and people don't follow through. So there's not a lot of trust out there. You get people coming out there who are like, "Hey, let me help you." Really? I've heard that before. So I get to say, I get it. I've been homeless too. I lived on the streets for 3 years, and with my kids, and again without my kids, and I get to share that experience with them, and it opens up an avenue of conversation where we can connect. I get to be an example of hope, because when we're on the streets in survival mode, we have little hope. So that's the I'm getting goosebumps because I love what I do. That's the difference. That's what connects me with them. I go out and hang out on the courthouse lawn and smoke cigarettes and say, "Hey, I'm Lori," you know, "What's that? What's your story?" And I met a gal there who has been living in this community for 7 years and has been homeless, and she's a small woman, you know, my age, and she just got vouchered. So that's where it's different for me, and that's where I get to offer hope, and that's a pretty good thing.
That's great. Thank you for sharing that. April, we know it takes, I think for too long in our community, before we had a 10-year plan, we treated the POV like the answer to homelessness. We know that our crisis response system can't end homelessness without support of not only everybody at this table, but everybody in this room and every sector of our community. So can you give us an example of how people can support your outreach efforts at Union Gospel Mission?
My heart is pounding, so. I would love for the community to see and gain relationships with the people that we get to serve daily, and understand that they're not the problem, that they just need somebody to come alongside of them and help them through their circumstance, whether it was an addiction or just an unforeseen situation that put them into homelessness. Volunteers are key to what we do each day, so we can step into the places that we need to do or need to be at to continue this process. And really for the community to see that homelessness is not the person. It's something that they're experiencing, and really be able to show them that they have this community to surround them and love them. And really my heart is the more we collaborate and do this together, the greatest success our community will have with helping those experiencing homelessness. Restoring hope is really the goal.
Thank you. So Randy, as you mentioned, you've been doing this a while. Can you tell us what you were seeing on the streets a few years ago before the coordinated outreach response, and then now how how does that compare to what you're seeing and able to access now?
Sure. I'm in my 15th year.
Bam.
Yeah.
The first 10 or 11 years were very difficult because of what I call trust, time, and frustration. Number one, we were losing some trust between the police department and the homeless community because of a time factor. We would respond after a 911 call. We would deal with it the best we can, and we were gone like that. We just didn't have the time. Because of that, we lost trust because we were there to help, but we didn't help. That turned into a very frustrating factor. We want to help, but now we're off to the next 911 call, and from there, another 911 call. Just didn't have the time, and like I said, we lost some trust there. I received this position, this dedicated downtown position, back in May, right around Memorial Day. It took me a while, it took me all summer, but I do believe I've regained that trust. When they see the bright yellow shirt, which I'm the only one that has, they know that they can come to me for answers or solutions. And because of that, the word has spread, I feel. More and more people are coming to me knowing that I can find those answers. I've been able to actually send people home around the country. I've had quite a few emails from family members that have not seen their family members in quite a while, and they're very, very thankful for that. So that's been nice. I have another person that I got a job for as a drywaller in Sacramento, and he just emailed me last week, says everything is great. And so it keeps me upbeat too, because I have all of these successes, and I'm working off of them. One success leads into another, and because of that, the trust factor is now growing. I'm on a lot of these, the homeless outreach team, the coordinated outreach team, and I work with them, and so I never had that. No police officer had that back in the day when I first started. We just responded, dealt with it the best we could, and we moved on to the next. We didn't have answers, we didn't have solutions, we didn't know what to do. We did our best at 4 o'clock in the morning when it's 0 degrees outside. And now I have connections, and that's what life is all about, is connections. Who do we contact next to find the answer? And that's the biggest difference between then and now.
Thank you. Thank you. So we all know that there are very complex systems that people have to navigate when they're facing homelessness. Kimberly, you work mostly with veterans, and every day you have to navigate those systems. So can you help us understand the unique challenges that veterans face, and maybe give us a success story?
Absolutely. I think veterans are particularly at risk for homelessness. A lot of them have mental health problems from their military experience. And I just have to put a quick plug in, because part of what I do is outreach, and I see a lot of people here. So we have, Volunteers of America does have financial support for eligible veterans that are homeless or at risk for being homeless. So to put it bluntly, we have money for rent, money for deposit, so send them our way. All right, so there are lots of complications with getting things done for veterans. The VA has the supportive services for veterans families that gives us the money, but we've got to dot every I and cross every T, and it's surprising how hard it can be for some people to get the documents together to just enroll them. And if they don't have their DD-214 form, we have to send off for it. It takes 2 weeks, sometimes more. So so they sit in, they finally got all of their paperwork, and we have to refer them. We got to refer them to all these people that are sitting at this table. We're supposed to refer them to the VA, and for a lot of people, you just can't say stuff. They're not really writing notes. I don't think there's certainly homeless people that went to school, but they're not writing notes, and so things can get lost. So we're supposed to send them to HUD-VASH, which is a VA voucher system, but it's only on Thursday, and it's only 2 to 4. Sometimes you show up and they're not there. But that's the voucher program that you can get on the wait list to get a voucher if you're a veteran. But you have to have the right kind of discharge. Now, if you have the wrong kind of discharge, we could send you to the university, and they have a clinic there for vets, and they can help you get an upgrade in your discharge. But you got to know about that to be able to get the upgrade. So, so then, you know, our primary goal with Volunteers of America is to get them housed rapidly. We're a housing first model within 3 months. But they have lots and lots of barriers. A lot of them is bad credit. We can send them to Homeward. They get great classes there for credit and poor references. So that's wonderful. So, but then if they go to a lot of places, like they've got to have double or triple their income. They've got to have a certain credit score. They've got to have a certain this and that. So that just getting a house can be difficult. We've had really good, I have had really good results working with private landlords, to tell you the truth, because there are veteran private landlords who have a religious-based inclination and will help people out that I thought would never get housed. So we've got like this little thing here that has 26 little places that vets might want to go. And if they need help getting a VA like disability, we can send them to Montana Veterans Affairs, and they need to remember how to get there and what the phone number is. And there's all these little things that can be so difficult. One of my best success stories, and actually I had a hard time deciding which one to share, but one of my best success stories is with a gentleman and his family member that was enrolled way back in July, and I was learning my job, and it was so complex that I made myself a graph to see if I could get everything done. But we managed to get him while he was looking for housing, and he didn't get housed until October. So we started in July, didn't get a house till October. We got him on Missoula Housing Authority's voucher list, and we got him on SNAP benefits, and we got him on LEAP, which is low-income energy assistance. We got him on several tax credit waiting lists. And interestingly, the way he got his house was one of these folks, not literally, but figuratively, one of these folks said, "Hey, there's an opening at Missoula Housing Authority, hurry." And we did hurry, and he did get housed, and he's successfully housed now. And he needed case management. Well, that wasn't easy. He does. I'm not even going to share the name of this organization that still has case management. He's got case management, and he got taken to the doctor. He knows what his medicines are. He's filling a pill box, and the case manager continues to help. And he's on the waiver list so that he can get even more intensive case management. And this is the final thing. I've taken too much time. I'm sorry. They went from, this household of two went from $1,400,000 a year to $23,862,000 a year, which is really wonderful. One of them got part-time employment. The other one got a veteran compensation that added to another compensation, and both of these individuals are disabled. So that's my success story.
Thank you. It's too bad she has no passion for her work, that's all I can say. So, just about a year ago, right, a year into the coordinated entry redesign planning, a bunch of folks, about 40 people from government and health and human service agencies met to talk about system-level gaps in the coordinated entry system. And as Teresa mentioned, just to reiterate, they identified 2 key positions that were critical in order to ensure success: full-time housing navigator and full-time housing retention specialist. It was just felt that we needed clear, positions with clear roles and responsibilities to be more effective and efficient and, assign accountability for helping people get and stay in housing. So, Yvonne, I understand that you are currently transitioning from the healthcare for the homeless social work position, the clinic position at the PAV, and into the full-time housing navigator role. And you've seen the system both before and after this new position was created. So tell us about what your job is and maybe some successes that you've already experienced.
Yes, so I've been transitioning to this role for a little over a month, so it's still quite new. But my role consists of either contacting the people themselves or contacting their case managers or even just finding them, with this lovely coordinated outreach team, trying to find some of these folks and begin filling out documents to get them ready for whatever housing resource they're getting ready to be referred for, whether that be permanent supportive housing through MHA, or if it's like rapid rehousing through a few different programs. And so I help. You have to verify homelessness. You have to prove that you've been homeless long enough to qualify for a lot of these programs, which is very difficult. So we work on that, and we work on getting IDs and any other sort of documents you might need. Excuse me. And then I help them get over to MHA for the appointments that usually it takes 2 appointments. Sometimes it can take 1 to actually get the voucher in hand. So if you have all your ducks in a row, you can walk out of MHA with a voucher and start the housing search, which, can take some time. This entails tracking down application fees. Luckily, 549 HOPE is really great at helping with that. And a lot of folks have housing barriers, so getting reference letters and things like that to work at getting a place for them and interacting with those landlords and property managers and try to convince them to rent to some of these folks. And then I introduce them to Sue over here, who's the housing retention specialist. So one of the successes I've had thus far, just in the last couple weeks, was a fellow that I had a hard time tracking down because it's hard to find people on the streets. Luckily, with the coordinated outreach team, I was able to find this fellow and connect with him. And he was really hesitant at first because, he'd been through the hoops before and it wasn't really working out. I convinced him that we could, just work on some of the paperwork and see he could, opt out at any time. So we filled out some paperwork and he got an appointment over at MHA. And so we went there. And when I walked in the door, he even said to me, "I almost didn't show up. I almost stood you up." So we were there at 10 a.m. on a Friday. We went through the application interview process, and since we had everything completed, he got to go for a voucher briefing right after that and get the voucher in his hands. Luckily, he was pursuing a Section 8 voucher a few months prior, so they had a file already open on him and had all the documents he would need to apply for an MHA property. And since the gal who works for the Shelter Plus Care program shares an office with the gal who runs the waiting list, she's like, "I have an opening. Why don't you go run over an application?" So we did, and somehow magically he got all the paperwork done the same day, and he had keys to that apartment by 4 p.m. that day. And so that, still riding that one out, so that's my success.
That's awesome. So Sue, housing retention specialist, how does your position help us toward the goal of making homelessness rare, brief, and one time only?
My position basically builds a safety net under people that have been chronically homeless. I connect them to resources in the community, doctors for mental health professionals for mental health issues, helping them fill out applications and forms and for LEAP and SNAP and Medicaid and all the other things that they need to remain successfully housed.
Great. We're going to turn to family homelessness. You know, a lot of people assume that the only people who are homeless who are people panhandling on the street downtown. So, Melissa, you are one of our local experts on family homelessness. Can you help us understand some of the common reasons why families experience housing crises and what your agency does as an access point and housing resource provider as part of coordinated entry, how you help them?
Great, thank you. So I think for family homelessness, I think County Commissioner Rowley talked about it when she made her opening statement. You know, we're seeing families that are extremely low income or low income, and so if they lose a job, then they're not able to maintain their rent. And I think that's probably one of the leading reasons for a family's homelessness. Also, domestic violence is also the leading reason for women to become homeless. But yeah, it's a mixture of things. You know, we've got substance abuse, we have mental illness, we have job loss, and medical issues. You know, if their car breaks down and they rely on their car to get to and from work, so they basically pay for their car to be repaired and then hope that they can then come up with rent somehow or use community resources for that. So the YWCA, as Teresa said earlier, we are an access point for coordinated entry. So anybody can come through our doors, and the folks that are trained in coordinated entry can meet with them and assess their eligibility. If they are eligible, really our first point is try to divert them from actually entering the shelter system. So we want to see if there's other resources or family or friends that they can stay with rather than entering that shelter system. But if we can't divert them, then we get them into the coordinated entry system and then talk with them about if they're eligible for the YWCA's program. And so we talk with them about emergency housing, which is 50 days in a local hotel, and then you know, hopefully then we get them referred to our rapid rehousing program, which is a rent and deposit assistance program, and we get all the referrals through the coordinated entry.
Do you have a recent success story about coordinated entry?
Sure, yeah. I had Allie actually write this up for me today, so thank you, Allie. So Ginger, and names have been changed, obviously, for confidentiality reasons. So Ginger recently had multiple deaths in her immediate family. And even though she had many skills and a positive work history, she was struggling to maintain her employment. Unfortunately, she and her 11-year-old daughter, Hannah, were evicted from their apartment because they couldn't keep up with rent. Ginger applied for public housing, but it wasn't enough income to access housing. Ginger began to spiral and needed emotional supports, so she reached out for mental health services. Her mental health provider directed her to the YWCA in order to enroll in the coordinated entry system. Through the coordinated entry system, she was referred to the YWCA's rapid rehousing program. This program, well, I just said, helps literally homeless families with children retain stable housing. And Ginger met with her case manager, who helped connect her to housing resources. Ginger attended housing orientations, completed applications, and followed through on housing leads. A property manager familiar with the rapid rehousing program called the YWCA with an available unit. Ginger applied for the unit and was approved. Ginger is now safely and stably housed. She can rest and continue to heal from her trauma. Since her basic needs are met, she is now able to re-engage in an employment search and take the next steps to regain self-sufficiency. Her daughter, Hannah, is stable, engaged in school, and can be a teenager without worrying where she's going to sleep at night.
Thank you. So we have a lot of people, this room is full of people, and I'm sure they all want to know from you what they can do. So what do you think, and we're going to do it quickly because there's so many of us, but maybe in one or two sentences, what do people here need to know about their role in ending homelessness and what short-term improvements they could advocate for? So, because we just heard from Melissa, I'm going to start with Lori.
Say the question again?
What do you want people in this room to know about what people can do to play a role in ending homelessness, and any short-term fixes you'd like to see?
I think the first thing, and it's been spoken here, is to break through the stigma, the stereotype that you might have towards people who are experiencing homelessness or who are in a bad situation. And foster hope.
Yeah, to piggyback on that, just being able to really educate yourself, whether that be through a ride along with the hot team or volunteering at the POV, or we do in-services like Teresa was mentioning. Just really, more than anything, I would say, just know that these are members of our community, and we all make up the whole. So,
What's an in-service example? What are some of the trainings?
Well, we're actually doing one at the Missoula Art Museum pretty soon, but we did one recently at the Senior Center, and they've been really awesome neighbors to us, so they gave us a call today, actually. It's just talking about responsiveness to if there's somebody who's maybe creating a nuisance or seems to be appearing or to experience homelessness, and kind of some tips on de-escalation, and rather than calling 911 and criminalizing it to a certain degree through just not having a place to go, people can call us, and that way.
Maybe you should say your phone number for our viewers and people in the audience.
We can. It's 406-493-7955.
That's for the hot team.
Yes.
Okay, thanks. Christy.
She told me she's skipping, so I'm going. So for the short term, I just want to remind people that the number 211 works anywhere in the United States. Someone will pick up that's a local person that will direct people to community resources. The second thing I'd like to say in the long term is I would like to see more low-income housing. There is a certain section of our population that are elderly, disabled, and they're probably, those people need to be housed if we want to be a compassionate society, and there's not enough of that. So I would like to see people support that, because there is a segment of people that need help. Thank you.
Well, we're all trying to do the same thing here, is actually make somebody feel like a human being again. And nothing changes that more than going to work and having a reason to wake up in the morning to go to work. And so if you know anybody that's just looking to hire just part-time, doesn't matter what it is, give somebody a chance. And when they get a paycheck, you'll see a smile that you've probably never seen before. So try that once or twice. Change your life too.
So you guys have heard tonight how complex homelessness is, and that we know that the solution is housing, but it's not as simple as just throwing a house in front of someone. There's a lot of barriers. So the solution is going to take all of us working together. And so I think what we would appreciate is that you get involved. I'm going to ask the audience a quick question, 2 questions, just so we can kind of gauge and see who's in the audience. My first question is, it's not really a question, I'm going to tell you what to do. I would like those of you that are in coordinate entry system providers to raise your hand. So you've signed our memorandum of understanding and you're working in the coordinate entry system. Someone up, someone down. You're not sure about it? How about those of you that are active members of the At-Risk Housing Coalition? Raise your hand. Okay, so if you didn't raise your hand, we would like to see you in the At-Risk Housing Coalition. And before we leave, we do have membership applications up here on the table. So we need to do this together. So my ask for you is to get involved and join us. So we're not duplicating and we're working together.
Well, that's great for me to go off of. Yeah, I would just encourage the community to come together. The organizations that are still doing things on their own. It's been amazing to see what we can do together. And she's mentioning 211. I'm going to mention what 549 Hope is. And we were able to, through this system, really change what we were doing at Union Gospel Mission to have the church come together with the city and really fill the gap and fill those needs like application fees and those ones that just need a little bit of rent and resources to get them through and keep them sustained prevention-wise and diverting as well. So I just would love to see the community come together and see that all of our organizations are working really, really well together and that we're able to adjust so we're not duplicating services. That the Union Gospel Mission is that's exactly what we're doing right now, is really trying to fill the gap in the city and see what we can do to help people and support them through the situation of being homeless or becoming homeless or having to even experience it.
Yeah, it's a hard one because it's such a complex issue. So I guess coming from somebody that has done housing navigation, you know, in the coordinated entry system, and I know it's something we're starting to get, but yeah, just lots and lots of affordable housing or permanent supportive housing, like actually properties, no barriers. Yeah, that would be amazing. So yeah.
Yeah, I would say to really encourage your, help your neighbor by paying it forward and maybe carrying things in your car, granola bars, hygiene packs, soap, shampoo, and just getting to know people and just building a relationship with people that are out there that you see that are experiencing homelessness. And just I've found in my experience in helping the homeless is they're big on relationships, and as you take the time and get to know them and build a relationship with them, they're going to really be more open to opening up to you. So just get to know your neighbor and help them and just pay it forward to them.
I would just say to get involved, take a tour of the Poverello, come and serve a meal.
I would say if you have a friend who owns any property, encourage them to, house some of these folks. A lot of these programs, it's guaranteed rent. It's kind of a no-brainer. So if you know someone.
Just to kind of echo what Yvonne was saying is I would love to see more investment by property owners, property managers, to get invested in addressing and helping solve this issue. These are our neighbors. Might be people that you know, might be some of you yourself. This issue is not going to go away. And so without that investment on a community level, as well as by businesses and citizens, we can all make a difference.
Well, Yvonne and Jake really talked about what I was going to talk about. But yeah, just kind of the call out for landlords. And so if you yourself own a property or friends or colleagues, and that talking with them about homelessness in our community and if they'd be willing to, rent to the folks that we're serving. So, and then, yeah, just getting involved. And this is such a great turnout. So thank you all for coming. Yeah.
Thank you all. When we were creating the 10-year plan, there were plenty of critics who said, a 10-year plan to end homelessness, that's ridiculous. You're not going to end it for everybody. You're stupid name. And we said, well, would you want us to call it we're going to maybe sort of try to end some homelessness for some people. We decided to aim high, because when you aim short, you fall short. And I think you've heard tonight, ending homelessness is doing it one person at a time. And when we make homeless people monolithic, when we talk about the homeless, that would be my ask of all of you. They are people, every one of them homeless for a different reason, and there is no one-size-fits-all solution. And if it were easy or cheap, we would have done it by now. So we are ending homelessness for one person, one family at a time. And as you've heard, it is challenging, it is complex. The The secret sauce is relationship and connection, just like in the rest of our lives. You know, building relationships, making connections between service providers, between people, between us and people experiencing homelessness. So I said at the beginning, we were lucky to have a panel of passionate, compassionate people who are changing and saving lives every day. So please join me in thanking them. I think I'm turning it over to you, and then you're going to turn it back to me.
Yes, yes, I am. Unless, April, I felt like you had some burning thing you wanted to tell folks.
No.
Do you want to go real quick?
I was just going to say, get your serve on, Missoula.
Okay.
That was it.
I just love this crew so much. This is great. Get your serve on t-shirts?
Get your serve on, yep.
Okay, so if we could get to the looking ahead slide. Okay, so looking ahead, again, we're entering phase 3. As a team, as a community team, we're going to continue to learn, improve, and collaborate together. We know that we're far from perfect. We know that we're doing our best to fill the gap and be the safety net in the community. But the faucet is turned on and it's turned on high. We cannot control the number of people that are coming into homelessness. So we're doing our best with the resources that we have. We're trying to work smarter, not harder. And so again, I mentioned all those meetings that we have monthly. That's us coming together, learning and improving, and using the new data that we're starting to see since we launched our homeless management information system last November. Continue to track and work towards achieving the HUD benchmarks and criteria for ending homelessness. That's a mouthful. But what that means is that other communities, especially around veteran homelessness, they have successfully ended homelessness. That's huge. And there's benchmarks and there's criteria that you have to work toward, and they are using coordinated entry systems to do that. So we have the blueprint, if you will, to end homelessness. There's a lot of support around financial support, as Kimberly mentioned, around veteran homelessness. So we're learning from that population and how that's happened across the country, and we're applying it here in Missoula, statewide, and nationally. Our homeless management information system will also be able to track that for us, which again supplements more of what we do, more than the annual homeless point in time survey, because that's not names, that's not telling us the whole story. It's giving us a snapshot of who's experiencing homelessness in winter time, but not summer, for example. And so this new system will, we have 55 users using it. That's huge, over 12 agencies. So that's going to help us get more real-time data that I'm excited to start seeing as we continue to learn and grow and train everybody up in it. Community of practice, technical assistance. It's really important that we're learning from other communities and experts in the system that are doing this work in other communities. So I'm involved in a community of practice with our HMIS administrator. They're through Pathways is the name of the company. So we're going to be learning with other communities that are doing coordinate entry, and he and I are the state representatives, and so we're just launching into that this month. So again, learning from other communities, so that way we always say, let's see, in the coordinate entry work, what do I say? Like steal and modify. We don't want to make things harder and create something anew when someone else has done it really well in in another community of the same size. So that will hopefully help us kind of project forward and continue to grow. Increase the supply of permanent housing interventions. We talked about that a lot. We've had some recent conversations. There's only so many vouchers available through Missoula Housing Authority. There's only so many rapid rehousing subsidies available through the Y and Human Resource Council and VOA. But with our new data collection through coordinate entry, we're going to start seeing how many people need some particular housing intervention because, like I said earlier, it would be great, housing is the solution, but we need to have the right type of housing and support available for people. And we need to know how many people need that so we can continue to grow and expand it. Continue to remove and address barriers in the system, local, state, and federally. Again, we mentioned that we came together a year into this work and just, decided, like, we have some system level gaps. How do we address it? So as a team, and I keep saying a community team, we keep coming together and talking about those system level gaps. We're so grateful for 549 Hope coming up and stepping up to the plate and filling in that gap for us, for diversion efforts, prevention efforts. Again, we want to try and decrease the number of people coming into homelessness because our resources are stretched thin. And again, we are trying to be smart how we use those resources, those limited resources, by targeting those resources to the most vulnerable. But there are a lot of other people that still need help. So the monitor, track, and report system-wide outcomes to public and stakeholders. Again, that is something that I look forward to being able to put up on our city website so you guys can start seeing what the reality is. I don't want to put a timeline on that. I don't want to put some pressure on people. But again, we've built the infrastructure, and with our new software, we're getting closer, and our HMIS administrator is helping us build a dashboard so we can see how many people are coming into homelessness, what is their length of time in homelessness, and what is our housing placement rate. And what I just described is we want to be able to get to a functional zero, which means that we are housing more people than are currently experiencing homelessness. So we want to, and then, we're getting to that rare, brief, and one-time only definition. So that way, we're rapidly responding to people that are in a housing crisis. I mentioned this kind of at the beginning, continue to improve the quality of our work. Again, we're not perfect. We're learning as we go. We're humble about what we're doing, but that's the only way that we do learn and grow is by listening to each other, listening to people that are experiencing homelessness and what's not going well. We at the end of the day want to reduce that burden on them and help them get quickly housed. Decrease the inflow with diversion. I really just threw that in there. I didn't really talk about diversion a lot, and I appreciate that Melissa talked about the diversion efforts with Coordinate Entry. But this is, just like you've heard about jail diversion, same thing with the homeless system. We really want to rely on people to have the resources and support to end their own housing crisis versus deploying the limited resources that we have in the system. So we are going to start and tracking better information regarding diversion and the cost savings as well. So that is kind of what it looks like.
Teresa,
looking ahead.
Can you, diversion, we all know what it is. It's one of those buzzwords, but talk about some of the concrete examples of what diversion looks like, because there's some very simple, sometimes small things that a grocery voucher, a bus ticket.
Mm-hmm. Anybody else on the panel want to talk for a second?
I'll
You've got
talk
some
for
examples.
A second. Yeah. When we get calls into 549 Hope, a lot of the times, a lot of the people have the answers within inside of them. They come in with a crisis and they don't realize that they can solve their own problems. So being able to be relational and talk to them, we were able to divert a family that literally just needed $10 to get their registration. They had a family in New Mexico and they were just stuck with $10 and some gas. So we were able to divert them to New Mexico to be with their family by being able to just talk them through the situation, paying the registration, getting them some gas, and getting them to where they needed to be. So there's lots of different circumstances. Like you said, groceries. Some people are a paycheck away. Like, do I pay rent or do I buy groceries? So really having those resources available for them when they come in with that crisis is key. There's tons of ways. Bus tickets are huge, and even really just people don't realize that they are able to do this on their own, setting them up with job services, getting their IDs, getting their birth certificates, things like that to get them started and moving forward in life.
Thank you. So when you hear that, people send their homeless people to Missoula, we send people other places too when they have a place to go.
When they have a place to go.
When they have a place to go.
We confirm that. And we have Julie and the Salvation Army here. They do a lot of vetting and making sure that people have a place to go. Absolutely.
Yeah. So Q&A now, right? We have about a half hour for your questions, and if you come up and push the button on the microphone and ask questions, I'm sure I don't need to tell you that we practice civility here. It's not like a city council. There's enough of that going on in other meetings and other places, but here we're going to be respectful, and we're going to ask questions, not make long statements. So please feel free to address a question to a particular panelist or to the entire panel.
And I hope I have permission to defer to the audience because I know I have some experts in the audience. So I'm going to give you a little warning now because I see you. Okay.
My name's Josh Decker. I'm curious, we've gone through the whole panel and no one's mentioned public transportation. And you've all talked about the kind of watershed moments where you divert from, make a choice to divert from homelessness or not. And our already excellent public transport. Is there any representative of Mountain Lion here? Or, okay. Super excellent public transportation that we already have can be used as a tool to reduce the workload for everyone here if it were made more excellent and made to exist on a 24-hour schedule that covered Sundays and holidays. So many people that exist at the bottom rung of capitalism work on Sundays. They work on Martin Luther King Day. They work on, you know, a variety of start and stop times that Mountain Lion doesn't cover. So when it becomes a pinch point in the budget, that person is made to decide between their car and a home because their car gets them to work, and that's a really horrible dead-end choice. We're in the midst of doing a bunch of downtown planning, and largely the downtown plan will end up being a babysitting plan for cars. And we need to include in that downtown plan super excellent public transportation that will help. And I'm curious if anybody works with Mountain Lion or if that's part of the concern on the 10-year plan. I'm looking at you in the corner over there.
I think that's fair game. I did pre-warn people. No, I'm just kidding.
Yeah, you're absolutely right, Josh. And so as part of the master plan for Mountain Lion, Sunday service, increased evening service, all part of the program, all subject to funding. But I couldn't agree with you more. One of the things I hear most often from constituents is what a difference that taking that fare box off the bus has made in their lives. And as you say, it's a deal breaker, right? A buck is a deal breaker for some folks. So it's in the works, and it's a matter of money. And I'm also going to steal babysitting plan for cars and use that occasionally. Thank you.
I could probably be loud enough. Thank you for doing that, because I wanted to bring up something that I think is missing. Do I have
Is the mic on?
Red. Hello. Is that it? I can be louder without the microphone. Okay.
We need it for MCAT, though.
Okay. So I noticed that half the people here aren't working in housing, so this is an opportunity to bring up a missed point, which is the FIT program at the schools, a way for community members to get involved. So FIT is Families in Transition. They assure that children who are experiencing homelessness have the necessary resources that they need to be successful in school. Programs after school, extra help tutoring, and transportation to their home school so they don't need to change. And so that's a way that families in the community maybe could contribute time in school with tutoring and lunch and granola bars in the classroom for kids who are not able to have those things. So.
Thank you.
Hi, my name is David Avery, and I appreciate the opportunity to talk to you guys. And I also just, wow, it's a great panel, and there are so many things I would have chimed in, but there's too many, including the transit. So I practiced criminal defense law here for 16 years, and I was a street lawyer, And then I got on the wrong side of the criminal defense desk myself, and I'm a board member of the Missoula Interfaith Collaborative, and then I also am a grant writer and a member of a group called Welcome Back, and we do reintegration work, people coming back from prison and trying to get back into the community and helping them. And that's just a preface for what my specific concern is. I've heard a lot of great stuff here, but I'm still not sure that there's a segment of the population of people who are coming back from prison. I think those in general are included in the homeless population that we're trying to address. But some people have to register for certain crimes they did, and there are some categorical bars. And I've experienced this when I was practicing and also trying to help people since then in terms of their eligibility for a lot of these programs. And I know some of that's federal, but it's not always federal, and some of it's just a matter of choosing, well, we're going to help as many people as we can, and they're the easiest people to not include. But I guarantee you, I know a lot of these people who have, I mean, they rehabilitate themselves with the help of other people as much as anybody else does, and some of them offended when they're young and whatnot. And I just really want the committee to know that these people need to be included. They should not be categorically barred. They should get the same consideration, case by case, as a person, as anybody else. They are human beings, and that's what we're talking about here is who's a human being, and that's everybody, whether you've got a house or not, or whether you're renting. And so if anybody can speak to whether or not I'm mistaken about the ineligibility of some of those people, of those human beings in what we're talking about, then I'd like to hear about it, but maybe I'm mistaken.
Well, I guess I'm not quite sure or know what your question is, other than, I mean, I think all of us, I can't speak for everybody, strongly agree with you. And I know, you know, we're all working with folks to, you know, help them get housed with criminal backgrounds,
Right.
where that's definitely a challenge. What was your specific question?
Well, I mean, Human Resource Council, thank God they're there and the work they do. They got a grant, and because their grant was only so big, and it's to help returning citizens, that's people coming back. They had to make a decision that let's focus on people who don't have to register. I mean, that's a logistical thing. And so once again, then here's a stigma that gets, you know, minimized and maybe even reduced for people who are returning, except for for registering people. It's the same place, and that's not. I mean, some of the city offices that I've worked with as part of Welcome Back or been on the conversation with, there's a similar thing there too. As a federal lawyer, I knew you lose a lot of rights and access to stuff, but Missoula has funding that's not altogether federal, and we have our own decisions to make in Missoula and in Montana. And I just would end by saying, you know, Montana's Constitution has a specific provision that says when you've done your time and then your civil rights are fully restored. And I think you're right to not check a box or those kind of things. That's included in that. And I just want these people to be looked out for.
Thank you for bringing that voice to the table.
Hey,
Yeah.
I'm so glad you brought that up because we're together on Partners for Reintegration. It's both of our passions. And it is a serious problem, but I think having committees, panels like this and being able to talk to members of the community, it is about changing your preconceived notions of this person is a sex offender, this person is a violent offender, so, you know, those are the ones who we have to push away the hardest. That's not always the case. You know, like you said, we all experience homelessness for different reasons, and it all, the barriers, the big barrier is stigma, and that's what needs to be broke down, is that stigma. So bringing it up in a group of community members is how we begin to do that, how we begin to start the conversation. I mean, it worked in banning the box off of employment for the city, so, we just keep talking about it. We keep talking about it until people are so familiar with it that it's like, oh yeah, sex offender, who cares?
Well,
Yeah.
thanks a lot.
Basically.
Thanks, Lori, for your encouragement. I really appreciate your comments. I also appreciate you guys listening to me.
I do want to share one thing, though, but I think the biggest thing that's come out of this whole coordinated entry system is the groups that we do have, like the landlord engagement. Us being able to engage the property managers and the private landlords and the landlords here in Missoula. The folks that we're serving, they have more accountability than they ever have, because they know that working through this system, that we're all going to be here to continue to keep them sustainable and permanently housed. So I think that's like a great opportunity through this, is us working together to really engage them and letting them know that whether they have that felony or not, there's still an opportunity there.
I agree. There's a great arc that's going the right way. I just want everybody to be included. Thanks a lot.
Thank you, David.
Thank you. And I just wanted to quickly clarify that for coordinated entry, we don't look at the sex offender or your criminal history or anything like that. We're looking at whether you're literally homeless, experiencing homelessness, or fleeing a domestic violence or attempting to flee domestic violence, sexual assault, violence, you name it. Where it gets tricky then is being matched to a resource, and you might have to appeal to get that resource. But what we find is people are getting resources, and then the tricky part is then, yes, trying to find a landlord willing to rent to someone that has to register. So thank you again for bringing that up.
And while my staff may kick me under the table, as we develop housing policy and as we look at municipal, local government investment in permanent housing, we can provide some incentives, and certainly, I mean, I happened to talk to a fellow who was previously incarcerated, had a job, was doing well, but was incredibly discouraged. He says, I got a job, I'm doing okay, I can't find a place to live. That barrier exists, and one of the things that we can do as municipal government is look at those barriers and do our best to break them down and provide incentives for people to do things that they might not otherwise be inclined to do. And that's one of the areas that I think we could certainly have a look at.
My last thing before we go to you, Amanda, is again, I can't echo enough to the importance of becoming a member of the At-Risk Housing Coalition, because Partners for Reintegration that Lori was speaking to is part of the At-Risk Housing Coalition, and you will receive information and updates. One of the one of the events that they're working on in the next few months, I believe in May, is a reentry simulation. So this is, if you don't have any experience with this, or you're a landlord, property manager, or someone that's curious, I recommend attending that reentry simulation so you can see how challenging it is when you're a returning citizen to figure out how to navigate the system. Good plug? Okay.
Hi, I'm Amanda Dowell. I know some of you. And so first off, thank you. Thank you for those that continue to do the work around this table, and thanks all of you who continue to do the work in the community. All right, big question. So I refer a lot. Allie, thanks for plugging FIT coordinators and MCPS. I'm a FIT coordinator, so I'm serving students and families experiencing homelessness and economic hardship through the school avenue and how we can wrap around, just knowing that it's all connected. So here's my issue, and I'm putting it as you move forward in the next phase. I make a lot of referrals to coordinated entry, and McKinney, Vento, and HUD are different definitions, and everything operates at a HUD. So here's where I am ongoing coming up to a barrier with the families and young people that I'm serving, is that they're actually not eligible to get on the list for coordinated entry, because in that immediate moment, they are not literally homeless on the street or unsheltered. They're doubled up, they're couch surfing, they're staying in their car, but then, oh wait, the car is crowded with all their stuff, and 5 people can't always be in a car. And so I'm just wondering, like, what is this team's plan on figuring out how the system itself is a barrier for folks that are still experiencing housing insecurity and instability, but don't meet the guideline eligibility requirements?
Great question. It's actually, through the At-Risk Housing Coalition, we have an executive committee, and I just put that agenda item for our team, for the group, for next Monday, because this is a federal definition.
Mm-hmm.
So locally, we need to decide what action we're going to take and what side of it we're going to support, because it is a decision that's at the Congress level right now. So we are going to discuss it, but again, it depends on, it's a federal rule, unfortunately. I don't know if I answered your question sufficiently.
Well, thanks for
but
trying, because it definitely is a hot topic. Because that's the thing, is
Absolutely.
we're getting a chronic, but then the bubble keeps growing of
Yeah.
like the working poor, and so like that's the next epidemic. And
Yeah.
so how are we meeting those needs and breaking down those barriers? Since
Absolutely.
they're getting turned away and said you're not eligible.
Yeah.
Try back when you're literal homeless.
Yeah, and I think it's a challenge because we know that the need outweighs the resource, how many, what we have, and so we're trying to be smart in how we, prioritize, right, that funding, that limited funding, and unfortunately there's not enough for everyone, and so we do have to figure out as a community how we're going to fill that large gap. And so it's not saying that people are less important, but we're focusing on folks that are chronically homeless right now, and that does include families with children. So there's no perfect solution right now, but we have to keep coming together to figure it out.
Thanks.
Anybody else have anything else? I don't want to steal the mic. Any other thoughts? Okay. Thank you, Amanda.
All right, first, thank you everybody for all of your hard work and a great presentation tonight. I appreciate it. I want to know more about the housing retention specialist. So as a property manager, when I have a tenant who's come in, they're living in my property through coordinated entry, let's say 6 months from now, they're struggling to comply with the lease terms, they don't have case management for whatever reason, how is the coordinated entry and how, the housing retention specialist, how can they help maintain that this tenant stay housed and, continue to comply with their lease?
Well, that's one of the things that I do is help people understand their role as a tenant, because they might not have had that role ever or have not had it for a long time. But like I do liaison between the client and the tenant and the landlord, or act as a liaison. I had a client who was smoking too close to the building and was getting in trouble for it and could have possibly lost his housing, and I was able to help with that situation and just talk to him about it, and he was happy to comply. He didn't understand that he had to be 30 feet from the building, and he didn't want to lose his place. He'd been homeless for a long time, and does that answer your question?
Yeah, and then also just kind of as a available long-term, I'm imagining, 3 years from now, this person's all of a sudden having issues for whatever reason, maybe they've relapsed, is the services that they receive through coordinated entry still available to them to make sure that they can maintain their housing?
I believe so.
And maybe it's
I'm
something
new
I
to
know.
this
Yeah, I know it's so
position.
new.
I'm hoping that it keeps going. Yeah, I believe so.
Thanks.
I was looking at the Poverello executive director on it because it's a funding question. Honestly, is what it comes down to is funding. So,
Teresa?
Yes. Yes.
Can I make a comment about what the lady just spoke of in terms of the definition for homelessness? Volunteers of America, we work with veterans, we work with homeless vets and vets at risk of being homeless. So if they're at risk for being homeless, they won't go on the VSPEDAT list, but you could send them to Volunteers of America at risk.
My question is going to be for the officer, Randy. Thank you for everything that you do. So I heard the word plug, and I'm going to plug something in regards to helping answer your question or your statement to us all, one of the best tools out there right now that I know of that's current is going to be a book or a movie called Same Kind of Different as Me. If you go and read that book, it's a whole story about how, man, his whole life was changed, not just the person who was helping, but the person who was being helped, right? Get your serve on. Helps both people. So because of that, then there's also a movie. So national bestseller, also a movie, another book's out, another movie's coming out too. But you can go get those two things. You can rent it on Netflix or get it at Redbox. Same Kind of Different as Me. And that's a great way of understanding in a visual, passionate, compassionate way about how you can get involved. And plug, we happen to have that national bestseller coming, UGM, in April. So you can come and listen to him one-on-one. So my question to you is, really, you are out on the streets, and I heard what you said, how things have changed, that trust, that time, that frustration level has changed. And so my question for you is, really, literally, how can we as a community help you?
That's a loaded question. I'll try and answer that one.
No guns or, you know.
Well, number one, when you see me downtown, come over and say hi. I love it when people say hi to me. I did a lot of years in patrol work, and when I dealt with somebody that was always at their lowest point in their life, so we rarely got hi's or thank yous. So it's nice. Now that I'm downtown a lot, it's nice to have somebody say hi. But to answer your question, I'll go back to the work thing that I spoke of. All you have to do is give me a name, a number, a business type. When I meet the homeless people out there, I am amazed. They all have some sort of work ability that they did before, and they still have those traits. They're still able to do this. They just are at the lowest point in their life, and they don't think they can go out there and do that. I've met carpenters, plumbers, even an electrician. I can find them work, and to partially answer your question, if you guys know somebody and you see me, all I need is a name and a number, and I'll give that person a call. I'll give that business a call and say, hey, I have the perfect person for you. Whether that works or not, might as well try, right? So the other thing is there's a lot of stereotypes out there that are not true. I had those stereotypes the first decade of working as a police officer, and I found out quickly they're not true. Not every homeless person I come across has some sort of substance abuse. That's not true. The vast majority of the homeless people I come across do not want to be homeless. So that idea that, well, they just want to live that way is not true. Just like we stated before, it's not always somebody between the age of 30 and 50, and that's not true either. It's anywhere from, unfortunately, what I've seen underneath the Reserve Street Bridge from 3 years old all the way to somebody in their 90s. It's not age dependent or race dependent. It's homelessness. Somebody is out of work, out of a place to live, down on their luck, and it's amazing just giving somebody hope in a direction, which you all can do too. It'll change their life and yours, that's for sure. So to try and answer your question the best, if you see me out and about and you have things that at home that you no longer use, I can get those to the right people, and I'm speaking of a blanket, shoes, boots, it doesn't matter. I'll find a person that needs them, and they're just sitting in your closet. They're not really doing anything good. I just come see me, come talk to me. My shirt is bright yellow. At night I glow in the dark. You'll find me.
Yes.
I typically work daytime hours, Monday through Thursday or Tuesday through Friday. I will be at Brewfest, but I will be working.
Yes.
Anyways, come and see me. I'm a nice guy. I realize I'm working law enforcement, but I'm a nice guy. Just anything you got that I can disperse to anybody else that really needs help, I can get it to the right person. I know all of them by their first name. So.
Well, thanks for being an officer of the law, but a police advocate. appreciate it. Thank you.
Maybe so. Hi. Thanks for coming together and doing this. It's very encouraging hearing all you speak about your successes as well as working together like you are. My name is Dave Ridgway. I'm a board member on the Poverello Center board, Go Hot Team. And I moved to Missoula just a year ago from Phoenix, and I was on the UMOM New Day Center board there for about 10 years and was pretty heavily involved in setting up our intake system there, which they had 11 organizations to get together. It was a mess. The FSPDATs and all of those things were amazing. So my question, I guess, is around numbers. One of the things we found when we set up the system in Phoenix was that immediately after setting up a centralized intake, the number of homeless seemed to drop because diversion helped. A lot of things happened. But there was a dip because it went back up again with trust, I think, was the issue. Homeless people exist that aren't counted every year. There's a lot of them on the streets, you know, the names of them that are absent the day we count them. But when that system kicked in, those people became recognized and counted, and suddenly there's a waiting list grew substantially. So I think the battle is how close are we to having an accurate count of the number of homeless in our community, and knowing the solution is people like you to help aid and divert and counsel them. How many people do we need to manage the population, and how many homes, low barrier entry, affordable homes, do we need to do that? Do we have a close figure on that yet?
You had to ask the question. I was just kidding. And thank you for speaking about your experience in coming from Phoenix. Just mirroring that we're doing the work that other communities are doing as well with Coordinate Entry. We are getting closer, I would say. When we first launched in 2017, I was the person. People were feeding me the updates, and I was doing it through an Excel spreadsheet. Not very efficient. Since we launched in November in the Homeless Management Information System, now, like I said earlier, we have 55 people going in there and putting in real live information. I think our family number is probably pretty accurate because it's a smaller population. I think that when we're looking at single adults, it's a bigger number, and so it's and we don't have a lot of staff to be able to double check and make sure those are all accurate. So what would you say, what was the last family number that we were looking at?
Actually just checked yesterday.
Oh, perfect.
So there was 49 families on the coordinated entry system. Mm-hmm.
And so, what else was I going to say about that? What was the other part of your question? Yeah. Absolutely. Yes, and so that is really the goal of this next phase, is to really dive in and get those stats. The point in time count will tell us, like you said, like a single point in January and wintertime that's not accurate. People aren't lining up to come and say, hey, count me. And it depends, we have outreach teams going out this Thursday night. We have all the shelters doing the survey. We're surveying everyone that comes to our Project Community Connect event on Friday, and then several other places, including the university. But again, that's only going to give us race, ethnicity, disability. It's not going to tell us how many times they're coming in and out of homelessness. And so we're just hoping the Homeless Management Information System will start to provide more of that accurate data and telling us, every single day of the year, what does homelessness look like that day. So I'm hoping that we're going to become more and more efficient. Would it? Yeah. Yes. Exactly. And they know where to invest that. Exactly. Would anybody else say anything? Yeah.
One thing that we are using this year too for the PIT count is the outreach grid, but additionally to that, it's going to be really helpful for a coordinated outreach team to use just like when we're in the field. So being able to like pin where camps are and like let people know in real time what need is happening, or referrals to like the PATH program, people that we think that they would meet. So being able to kind of, or like OAA services, people will be able to help people more efficiently through things like that. And I think we'll be able to get a more appropriate count that way as well.
Eric, the feds are here. I've certainly noticed it. I mean, we consider ourselves like the principal private sector champion of the plan in terms of educating the community and raising funds for things that, you know, the plan needs, like supporting Project Community Connect and Employment Connect. I think that people are slowly learning that their stereotypes about all homeless people being on the courthouse lawn are inaccurate, and that many of our homeless families and neighbors are hidden. And they're slowly learning that there is no one-size-fits-all approach, but it takes forums just like this and people just like these to keep telling that story and addressing stereotypes. I mean, I just got buttonholed at the dollar store the other day by a woman who had recognized me and had read me quoted in the newspaper talking, I can't even remember the story, but it was something about people, you know, not wanting to be homeless or something like that. And she had one anecdote about somebody she had tried to help, and you know, I didn't want to get into it with her and say, you know, you probably should have called somebody who was actually a trained social worker, you know, rather than this, because these are some of the things that happened. But it had been a long time since somebody had really demonized homeless people to me. And so one baby step at a time. But I do think that people want us to solve it and are willing to educate themselves about that it's not the POV's responsibility, it's not the city's responsibility, it's not the county's responsibility, or the churches, or United Ways, or the Salvation Armies. It's all of us. We all have a role to play. Teresa, oh, Lori.
So I can tell you from a personal experience the change that I've seen, because in 2012, I was in my last year of homelessness. And at that time, it was, I had service providers, but all of those service providers were so, like, this is my voucher, this is my landlord, you know, and
they're cylinders of excellence.
Yeah. So when I was coming off the streets, my only choice was to live in a storage unit to get clean. That was the only thing available, and I lived like that for 7 months until I was able to finally get my voucher, which was great, saved my life, got me a house, and here I sit today, housed and jobbed and pretty happy. But back in 2012, when this first was happening, there was absolutely no communication, no coordination. It was fend for yourself, you know, and a lot of it's your fault. You got yourself into that situation. So, bravo, everyone.
Yeah, I got something as well, too. And I want to go off of that. In 2013, I was in the same place. 25 years an addict, homeless for 2 years myself, came out here thinking my life was going to be better. And really, in California where I was, there was never anything collaborative this way. So when I had the opportunity to have some people come alongside of me and help me through that situation, it's truly a blessing to sit here and be on the other side of it and know that every heart is invested in helping somebody out of this situation, that when you're in that hopeless state, there actually is hope, that this community is actually coming together. Because I can say, when I needed help then, I didn't know where to go. I didn't know where to turn. But really being able to ask those questions of where do I go, and now that we're all working in this collaborative form, that it's amazing to see how many people are going to get help through that.
It's amazing that now the people experiencing homelessness people are coming to them. Can we help you? Instead of them coming to service providers saying, can you help me?
Can I say one thing that will be completely different? I think that when I was a child, there was a very popular commercial, a Native American with full headdress with a tear going down his eye about trash. And I remember there was a lot of trash on the road, and things have gotten really much better. I remember as a little kid throwing stuff out of the car, and so slowly that took over. I think that most of the people in this room are Missoula liberals and a bunch of hippies. And I frankly live with 4 very conservative, very different people, and I do not think they have a warm, fuzzy feeling about homeless people. So I think gradually things will change, but we are in a Missoula bubble, and we're all most of us are in social services, so we're good do-gooders. So I just had to put a little, little extra something different there.
No, and I appreciate that, Kimberly, because I think we hear that if you build it, they will come, that we're resource rich and we're, people are coming here because of our services, but then there's the other side of you're not doing enough, you're not, you don't have shelter for all. So I think it's this balance of, fighting both of those and trying to come together and find solutions and the funding and everything else. But I just think we're just so fortunate because we do have people coming to the table, and at the statewide level, when I do go to other communities, I do get the daggers thrown at me because we have the free mountain line, and we receive the most federal funding out of the continuum of care in the state for our housing as well. So we have a lot of things that are a lot of great things. And I also want to say we did not plant you. I didn't know you were coming. I'm so glad you came. Thank you for the kudos to this team and the folks in the audience that are working as well on Coordinate Entry and the Reaching Home. So thank you. I got to wrap it up. You good with that? Okay, I'm going to steal it. If, Montana, you wouldn't mind putting on the upcoming events. So we've talked about this. I'm just going to throw it up here so you guys know it's happening. The annual point in time count, that is happening on January 31st. The 13th annual Project Community Connect is happening on this Friday at 10 to 3 at Zootown Church. So please help spread the word so people can attend. A lot of folks in this room will be there as service providers. And then I just want to put up the contact and resources. So my contact information's up there. There's materials, documents, and participating agencies can be found on these websites, the participating agencies for the Coordinate Entry System, that is. All of these things in this whole presentation will be on our city website, Housing and Community Development. And lastly, Thank you. Together, we're working better and smarter to end homelessness in Missoula. We do this work because we believe and know that ending homelessness is possible. And I want to give a quick thanks to kiddos at the Family Shelter through Family Promise, Missoula Interfaith Collaborative. They put together these signs for us. So these are kids that are experiencing homelessness. And again, we're working hard to make sure that homelessness is rare, brief, and one time only. So thank you, everyone.